And welcome back. Governor Henry McMaster declared this week, October 9th through 25th, Spiritual Care Week in South Carolina. This is a time to recognize the work of chaplains and grief counselors and mediators and advocates and people who care for others at some of the most difficult moments of their lives. And joining us today is Reverend Demet Jenkins. She's the Director of Spiritual Care at HCA Healthcare. Reverend Jenkins, thank you so much for being with us.
Thank
and that
you.
announcement just, of course, came last week with a big celebration
Absolutely.
at HCA Healthcare.
And it was a great celebration.
Well,
We are
congratulations
excited
for that.
Yes.
Yeah. So, of course, we know that this week is Spiritual Healthcare Week. Give us an idea of what that means exactly and why it's so important that you talk about it.
It is really important because Spiritual Care Week is to acknowledge like those persons you just named, healthcare workers, chaplains in the community and the healthcare and hospice and all of those spaces where we care and love on people who may be going through a crisis at that time. So Spiritual Care Week is a national Spiritual Care Week. This is 40 years in the making. And so we just wanted the world and the community to know that thank your chaplain. Acknowledge your chaplain. We do lots of great and loving work for our community.
And you're right, I did somewhat of a laundry list of names, and sometimes we don't know some of the spaces where you are working, and it's very important work. When people are really challenged and feeling sometimes at their lowest, you are the people who come in. But where are some of the spaces we might see some of these caregivers?
Yeah, right here in Charleston, of course, all of our hospitals and our hospice, and then we have coastal crisis chaplaincy, you have the prisons, you have all of these spaces. Even in the sports arena, there are chaplains. In the corporate world, there are chaplains. So we have chaplains across the board. So it's not just in a crisis. Sometimes it's for staff support, just to encourage our team members to make sure they're maintaining collegiality and wholesomeness while they're at work.
And you're trained professionals. You know, these are people who go through specific guidelines and those kinds of things so that you know how to enter these situations and provide the most amount of care and comfort.
Absolutely. And each of them have different educational requirements, but to work in a hospital, you do have to have a Master's of Divinity and clinical pastoral education training above that.
So, Reverend Jenkins, what have people said to you over the years, without disclosing too much, but I'm sure that it's a service that's really important to people when they need it most. So what have some of your experiences been?
People have said, just today, somebody said, thank you so much for just stopping by, to just check on my father, to make sure everything was okay, because I can't be there every day and all day, but to know that someone came by, sat with him, talked with him, said a prayer with him, they were very grateful for that. So those are the kinds of things. And we're not always there for crisis. There are people who get good diagnoses, like they thought they came in for one thing and it turns out to be a positive thing. The outcome is good. So it's not just that, you know, we're coming in at a bad situation. Sometimes we're there to celebrate the good news.
All right. Well, thank you so much for your good work in this community.
Yes,
once again, celebrating and recognizing those who care for people at times of celebration and sometimes moments of sorrow.
Yes.
All right. We, of course, want you to stay right here with us. We are coming right back with more of News 2 at 4 after a quick break.